for tuning in, guys. This is just an opportunity for us to explore a few wider issues that I have become increasingly concerned about within our clinic. We see young women right the way through to elderly ladies and men. And I've noticed that there's been a bit of a lack of understanding in a lot of the patients in general with respect to hormones and how their hormones can be impacting. And I'm not a specialist in this area, and I have had the absolute pleasure of recently being reintroduced to a really, really fantastic colleague and friend who is a GP and has a specialist interest in menopause care, Dr. Naomi Potter. She's a long-standing friend. We've known each other for probably about 15 years. Yeah, we're both quite old. And she's had a wealth of experience in training under some really sort of influential people in menopause care, Nick Panney, former chair of the British Menopause Society, and she's extremely passionate about providing holistic care for women in midlife, and has a deep passion with making sure that things are done the right way, which is one of the reasons why I really wanted to reach out to Naomi and see if we could offer a great sort of combined service where we were able to offer our ladies that may be experiencing menopause symptoms, and that includes ladies that have unfortunately undergone a premature menopause, and also look at potentially how some of the wider issues of hormonal treatments may help support some of these ladies, and how some of these hormonal changes can impact on their health, their well-being, their psychological state, but also their skin, and whether we can provide measures of support that will help. And Naomi has kindly agreed to spend some of her time with me going through some of these issues and answering some really important questions. We've already had quite a few that have come through already from some of you who've really responded well to our previous Instagram posts. So thank you so much for engaging already, and thank you so much to Naomi for agreeing to be on board with this, because I think it's a really, really important issue, and I think there's a lot of misinformation out there and a lot of empty areas of understanding, and I think this is going to be something that will really help going forward.
Wow, that was great.
Fine. Okay, so I think one of the first things I should ask really in terms of some of my patients that have been having queries about what might be going on with them hormonally. I mean, can you just give a brief overview, Naomi, about what happens with female hormones over lifetime, and just your opinion about what you think some of the changes might be due to?
Yeah, so women are different to men in that their hormones are constantly fluctuating. So as soon as you hit your teenage years, you've got a constant cycle going on where estrogen levels go up, progesterone levels go up, and that fluctuation in itself can cause skin changes. Yeah. And then pregnancy affects the skin. Often women report the best skin of their lives during pregnancy. After pregnancy, things can change. And then certainly when you hit the perimenopause and menopause, women often notice changes that they've never experienced before.
Okay.
So rather than just kind of oiliness or spots or dryness, it can be aging. That's what women tend to report the most, is that it's a rather than a kind of very slow, steady change in their skin, it can be a much more rapid decline. In their perception of their skin quality. And it's things like a loss of a kind of youthful dewiness, fine lines appearing, a loss of the kind of cheek apples, and face kind of just feeling, they often say my face is just sliding down.
Yes.
And it's the decline in estrogen that causes that. The skin tissues, just like tissues throughout our body, have got estrogen receptors, and so when they haven't got that estrogen stimulating those receptors, you end up with the inevitable kind of aging changes.
We should probably also as well actually explain what menopause is, because there will be some people out there that don't necessarily understand what the definition of menopause is, and what you might expect.
So the menopause is really when your periods stop and you are considered to be postmenopausal, when you have gone for a year without having had a period.
Okay.
But perimenopause can last a long time. It's really, rather than it being a line in the sand, what I tend to explain to my patients is that they're at the end, when you're late 30s, early 40s, and then definitely when you're kind of into your mid 40s, there is just a decline, a slow decline in the amount of hormones that your ovary produces, the estrogen that your ovary produces. And even though it's fluctuating, it tends to be on a kind of downhill trajectory. And that is what the perimenopause is, and it's the symptoms that result in that lowering estrogen that can affect the whole body.
So there's actually been a few of my patients who have made contact through personal DMs. I did suggest that if there was anybody with any sensitive issues, they might want to DM me, and a few of them had come back with concerns about sort of premature menopause symptoms. So if somebody is getting, some of them have had symptoms in their sort of late 20s, which is just awful, and I wonder whether your advice to them would be different to somebody who was going through it a bit later in life.
I mean, certainly, if you're going through the menopause in your late 20s, early 30s, or even all the way up to your 40s, then the advice is that you need to have estrogen replacement therapy in order to protect your bones and your heart and your brain. Because otherwise you get that premature acceleration of things like osteoporosis, cardiovascular disease, strokes. So it's really, really important. If you've got a menopause in your late 20s, then you should be investigated for an underlying cause.
Okay, thank you. That's really important, because one of the things that we want to stress as part of this is that we don't just want people to sort of hide away and self-diagnose, or even just take any advice that we're giving here as sort of hard and fast rules, because everybody will be different, and it's really important to get additional advice through a doctor, through another consultation, specific to you, because everybody's needs will be different. And like I'd said previously, there are potentially other conditions that might be interacting, that might be giving people symptoms that they have. So it's really important to get that investigated.
Definitely. If you're under the age of 40 and you think that you have got menopausal symptoms, it's really, really important that you go to your GP and really press them into investigating you, and don't be dismissed by "you are too young for the menopause," because that is not the case.
Okay.
No one's too young for menopause. So. No. The younger you are, the more important it is that it is identified and treated.
Okay, perfect. Well, that's really useful. Thank you very much. Lots of useful gems there. Where we have an awareness in the industry that menopause causes changes in our physical structure because of the changes in our skin integrity, or whatever it is that the estrogen or the combination of hormones and the changes of the hormones can impact in different ways. It's really important to have that understanding from your side as well, how that works, what the changes might be, and work out whether actually some other treatment might be necessary for those clients.
I guess that's the advantage of going to an aesthetic doctor for treatment as opposed to a beautician who's got a diploma in fillers or something, isn't it? Because you
absolutely. Yeah, we have a deeper understanding as to what underlying things might be causing the symptoms that you're presenting with. It's just the same as going to the doctor with chest pain. You know, you have to look at what the other potential issues are. You don't just say, okay, it might just be a muscle pull or something like that. You have to think, okay, what's deeper? How can I make sure that I'm doing the best for my patient? Because a lot of the time, I don't think it's right to proceed with a treatment. And a treatment might not be necessary at that time. It may be that I say, we need to sort out your skin before you can deal with this. We need to do X, Y, or Z before moving on to something else. In terms of aesthetics, you tend to have the illusion that this is a very superficial industry. It's about looking good, it's about making people feel better about themselves, and a lot of the things that upset me about the industry is that sometimes people can make it feel like it's a bit like there's a lack of depth. And I always in my consultations to spend, to be honest, the majority of the treatment time just talking to people and figuring out what it is that's going on in here. Sometimes it's not about treating them. Sometimes it's about sorting out other problems that are going on in their lives, which obviously you can give them guidance for, or you can make suggestions with.
Or even just identify it. Just making,
just identifying it and actually showing them that some of the things that are probably in the back of the head are actually validated. And there are other things that they can probably look at that they need to consider before thinking about a treatment. I mean, there's several times that I've identified that there are other medical problems going on. People have come in, for example, with problems around their eyes, dark circles, increased pigmentation, that sort of thing, or swelling, and they want under-eye treatments. And I don't, if we need to exclude other causes, we're still doctors at the end of the day. We still need to look at what the core problems are. And there may be that, we've identified people who've had problems with their thyroid and needed that treating first and foremost, because the treatments they were coming to me for would not have solved the problem. There are so many different options out there, and we've got such a great opportunity with lots of different colleagues in the industry that we can refer to if we think that something else is going on. And this is why the kind of network with you and other professionals and ophthalmologists and dermatologists and surgeons, these are all really, really important to have this collaborative sort of way of managing patients. It's really helpful.
No, it sounds, but I mean, it sounds like you've got it absolutely nailed.
It isn't enough to just get somebody in, get them on the chair and whack filler in. It is about treating the person, and I think my patients definitely, that's what they appreciate about my treatment of them. It's about what's right at the time. And sometimes it's just, you need to come in and have a chat. And sometimes people just need a chat and a hug, and a cry, and they feel better. And the amount of times that's happened, and people come back because people feel that you're really after their best interest, which is what we all need to be. So hopefully this session, fingers crossed, will provide your patients and my patients with a better sort of understanding as to kind of the an overview of the issues that they may be experiencing. One of the things that I think came up time and time again during the sort of questioning that we were having prior in our sort of reach out was really with respect to, like you're saying, about the facial downward migration over time. And I think part of that is because of if you imagine the aging process affects muscle, it affects skin, it affects bone, it affects fat, and what we find is that the main things that people are concerned about is the downward migration. Okay, now we've already spoken about estrogen affecting bone density, and part of that will cause an acceleration in bony loss as you transcend through from perimenopause right through to postmenopause for up to the first 4 years. And the majority of the changes that occur are in really specific points in the face, and those are points around here, in the bone next to the nostrils, around the eyes, which makes the eyes look a little bit more sunken and hollow. It affects the bone structure here, right at the corners of the mouth. So often people will get this little sort of downward migration and jowling at the corner of the mouth that you see here. And you also get these lines that you see going from the nose right down to the corner of the mouth. And that can happen even very early on in an adult life as you have bony changes, because the bony remodeling occurs all the time. And if you think about the face as being a coat hanger, it is the structure that everything else is formed upon. So of course, when you have this loss of the structure of that coat hanger, what will happen is the tissues no longer have anything to form on. And you'll get this downward migration. You also get fat atrophy, and you might be able to give a little bit more information about the estrogen side of things with fat, but there is definitely fat atrophy, which basically means the fat starts to get a little bit destroyed and dies away. So you lose fat pads inside the face, and they lose that's the loss of the apple cheeks that you see. You also get degraded muscle function and muscle density. So things just aren't as plump as they were when we were in our early 20s. The skin itself, you can have lots of changes within the skin. Estrogen causes changes to the blood flow around the skin, which also impacts the hydration levels, and you lose something called hyaluronic acid, which is basically a product which is within the skin tissue, and it helps with the hydration and plumpness of the skin as well. You also lose collagen, and that can cause further laxity within the skin itself. So there's lots of different interactive changes, and I think, estrogen is one of them, but estrogen has a big factor on the development and generation of so many tissues, and I think this is why it's important to be able to think: are those levels optimized? Are we doing everything we should be doing? Is there any other way that we can help to sort of manage ourselves on a more holistic level to make sure that everything is where it should be and that all of our cells are optimized where possible?
So apart from HRT, which I can talk about a bit later, and things like looking after yourself and exercise and diet and things, is there anything that you can do, as in Dr. Melissa, in order to help us prevent the downward slide of our faces?
The inevitable downward slide.
Yeah.
Yes, I mean, I try to. I'm very much a fan of doing the bare minimum, okay, and doing the minimum that people need, and really starting with managing yourself. So, what are you doing in terms of your diet? Are you having a healthy diet? Lots of vegetables, lots of fruit. Is it balanced?
Is there any one thing in particular that you should focus on, or anything that is particularly good for skin?
Well, in terms of skin structure, vitamin C is a great antioxidant. So you can apply vitamin C products to your face, and there's lots of products out there. And if people want to go through those things, then we can, it's best to do this discussed in a consultation so that we can give tailored advice for an individual. Vitamin C topically works really well to even out skin tone. It helps with free radicals, which can cause damage to the tissues, and it helps to give an overall sort of nice, smooth appearance to the skin. It helps with skin recovery. There are collagen peptide products which you can take, which you can orally, and those can come in the form of a drink or tablet forms. There's so many things on the market, but several of the drink products are thought to have better bioavailability, so the uptake in your body, so more is available to do the job that it needs to do, and those will help to prevent the breakdown of collagen over time, and help to restore the collagen levels that are there in your tissues, which will help to improve both the skin integrity and the skin laxity and the support structure. So it helps to stop that decline that you get with the collagen levels over time. There are products such as omega-3 and omega-6, which you can have again in tablet form, or you can find in combined drinks, which help with the skin structure. They provide essential fatty acids to the skin, and there's lots and lots of bits and pieces which can help to support the structure and the development. And really, one of the essential things is maintaining your hydration levels as well, because you can do all of these things, but if you're not drinking enough fluids, removing toxins from your body, and clear fluids, water, not teas and coffees as you're drinking there, I can say. Then these are all things which will help to improve the skin. And I'm also a firm believer on maintaining and managing stress levels, because the impact of stress on your skin, I think, is underrepresented, and we all know that in times of stress, we wake up in the morning when we've got that important interview or video, and our skin is not done us the best of favours, and we have breakouts of spots, and some people have troubled more with that than others, and we do need to do a little separate conversation about acne and changes to the skin, because I think there's a whole other topic which we need to go through. But the impact of stress on the skin can be quite profound, and it can cause some people some big problems. So managing that, looking at meditation to help reduce stress levels, can reduce what we call a post-inflammatory response, which is basically inflammation that can worsen pigment problems within the skin. So, these are all things which women going through all areas of life can adopt to help to support them. And I think a lot of your ladies may also complain of pigment changes around here, perhaps, pigment changes here, due to probably changes in the hormonal levels as well, which they just accept and they think is just, it's one of those things, I'm getting older. But actually there are things that we can do with skincare products. There's a massive range now of skincare products and things that help support people to get much better conditioning of their skin. Sorry, you're about to say something.
No, so I was just going to say, so in terms of kind of skin impact and how we can improve skin quality at the menopause. So there's HRT. There's kind of, it's a three prong, isn't it? There's HRT. There is lifestyle, which seems to have, so managing stress, managing intake, reducing alcohol and exercise, and not smoking and stuff. And the third prong is the skin products and treatments. And I guess it's
it depends on it depends on kind of how far you want to go with it, and the severity of your issues. But I think early management of stuff will help to prevent rapid deterioration down the line. So if you're looking at the lifestyle and the basic things in terms of diet, hydration, all of those things, and then you're thinking, okay, what can I do with skincare? There are plenty of products with, so for example, retinols and exfoliants, and these are all products which can help to improve the skin quality and promote skin health. And I think,
and there's a cream, it's something that you put on your face, a retinol.
These are things that you would add topically. There are some treatments if you have sort of acne problems and things that you might take orally, but those would be probably best discussed with a dermatologist, and we would do a consultation with people and recommend if we thought that it was out of our area of expertise, we would refer them on. But there are a lot of over-the-counter retinols, but there are also a lot of medical grade ones. So I think the best thing to do would not really be to dabble with stuff. Really, if you want an effective treatment, just have a consultation. We offer free online consultations for people, and we can do video consults, so we can have a look at what their skin's doing, or they can send us images.
How does it work? What would people expect to see in terms of improvement?
The retinols are tricky ones because they can cause a lot of increased skin sensitivity, so they have to be used with care, particularly the medical grade, but they will help to the skin to regenerate, and they will help to provide a smooth appearance and help to repair the tissues, so that all the new skin cells that are coming through, you have a nice even tone. It can help with, along with other products, to improve the overall appearance of the skin.
Sorry, just to interrupt. So I read somewhere though that if you use a retinol, and this might be just completely wrong, what you're doing is even if you have an immediate positive effect, what it then does is speed up so that you actually increase the aging, because you're increasing the rate of the cells coming through. Is that right, or is that just not right?
I mean, the skin regenerates all the time, so you're not working with a finite amount of cells that you're getting rid of.
Right. I think that must be,
you're helping the tissues to regenerate, and you're providing the other necessary ingredients with other treatment regimes that you may be including, such as vitamin C, and moisturizing treatments within the skin, and whatever else that we suggest is required to prescribe in order for people to be able to get the right outcome. It's like any prescription. You have to sort of figure out what the diagnosis is, whether this is the correct skin condition to treat, and then move on in whichever direction you feel that you need to. And I don't use a lot of retinols on my skin, and the reason being is because I don't like the sensitivity, and I don't like, I probably shouldn't say that, but I don't like the feeling.
People are more sensitive than others, aren't they?
Absolutely, and I find it gets my skin extremely sensitive, and my skin is already naturally quite dry. I have to add lots of moisturisers to my skin in order for my skin to feel hydrated, and it's got a lot better in recent times, but I can't use a retinol every day because I wouldn't be able to do anything, I wouldn't be able to go outside, I wouldn't be able to do anything, it would be quite sore.
If you could tolerate a retinol every day, would it be okay to use it every day?
Yeah, it's absolutely fine as long as you build up to a level of tolerance, and we often say to people, maybe just use it once or twice a week in the first instance to make sure you're okay with it, and then build it up. And of course there are different strengths as well, and depending on what it is that you need to treat, we might recommend a different strength for different individuals. So it's really individualized treatments. And I think the important thing is to make sure that the treatment is right for the condition that you're presented with. And I think it's really important to make sure that we get it right at the beginning, and then we can adapt the treatment plan. Often people will have a month's supply of skincare treatments, and then I'll have a look at what their skin's doing at the end of that 4-week time frame, and we'll say, okay, let's add in this, and it may be that we add in some of the skin drinks that help to promote collagen synthesis and rebalance the skin, or it might be that we are using an oral treatment to help with acne, or whatever the scenario is. So there's a range of different options based on whatever the diagnosis is underlying. Okay.
If you could tolerate a retinol every day, would it be okay to use it every day?
Yeah, it's absolutely fine as long as you build up to a level of tolerance, and we often say to people, maybe just use it once or twice a week in the first instance to make sure you're okay with it, and then build it up. And of course there are different strengths as well, and depending on what it is that you need to treat, we might recommend a different strength for different individuals. So it's really individualized treatments, and I think the important thing is to make sure that the treatment is right for the condition that you're presented with, and I think it's really important to make sure that we get it right at the beginning, and then we can adapt the treatment plan. Often people will have like a month's supply of skincare treatments, and then I'll have a look at what their skin's doing at the end of that 4-week time frame, and we'll say, okay, let's add in this, and it may be that we add in some of the skin drinks that help to promote collagen synthesis and rebalance the skin, or it might be that we are using an oral treatment to help with acne, or whatever the scenario is. So there's a range of different options based on whatever the diagnosis is underlying. So I think the treatment for things are, it's a multifaceted treatment. You can look at the diet and lifestyle, you can look at the skincare products, and some people that won't be enough. And in those clients, we might have a combination of, say, skincare and look at whether the next stage is the interventional stuff. So the range of facial injectable treatments that you might have, and those are obviously individual designed treatment programs that we would undergo, and we may refer you for laser treatments, or we may refer you for all sorts of other things, and if we feel that we can't meet your needs, then we would refer on, for those patients that want to go further, we would refer on appropriately to plastic surgery or wherever.
So if you could kind of say what were the 2 best things that you can do for your skin and the 2 worst things, what would you say to patients?
I'll take the worst things first of all. So smoking. That really upsets me, because it's something that you can it's a choice that you can make to actually prevent so many different issues with your skin, with your health in general. So stop smoking. And the other thing is sun exposure. Really, I mean, those are the two most significant areas that can cause problems, because the aging effects of the radiation on the skin, the risk of skin cancers, the risk of development of additional skin lesions, hyperpigmentation problems, you know, all of these issues, and the combined effect of the lifestyle negative factors like smoking and drinking and sun exposure will definitely cause a rapid deterioration. And I'm sure once you get past the menopause, you definitely realise that all of those things are sort of compounded, and the downward trend is even more significant. I mean, this gorgeous weather at the moment, we're very, very lucky, and you need to be protected if you're out there. Wear your SPF 50s, make sure you're looking at skincare products that have either been prescribed perhaps, or they're SPF 50s, and they do cover a good range of UVA and UVB.
And is that information on the bottle?
Yeah, it's usually on the bottle. I've got some here. I don't really want to advertise, but basically this, you'll probably see that these suggest there. So you've got UVA, UVB, HEV and IRA protection in that product. This product isn't great actually for dark skin, because most of the products on dark skin will give you a bit of a grey white complexion.
Right, because of the film.
Yeah. So there's so many different kind of products on the market, but I mean, I don't mind. So I'm quite happy to plaster this on if I'm out and about, but there will be people that will feel self-conscious with that. So there are other products which don't have so much of that, and some of them are more sensitive to your skin tone. But if you're a lighter skin tone, I mean, your need for sun protection is there regardless of your skin tone. You only have you have a lot of people who have the misconception that darker skin tones don't need sun protection, but your protective factors within your skin are minimal. They're less than your sunscreen. Yes. So regardless of your skin tone, so you do need to have that protection against the aging skin process changes and also the skin cancers.
Okay, so I guess you can kind of flip it and say that the best things that you can do for your skin are to wear sunscreen, you know, high protective factor sunscreen.
Yeah, I forgot to answer the other half of the question. Yeah, sorry. But one of the best things you can do, and just be really vigilant with your skincare. The main things that you can do to help support yourself. And hydrate, really, you know, and those are the things that aren't really going to cost you very much, and it's just, you know, your routine processes, and you know, I would stress that there are lots of things out there that might claim to be great products, but really the medical grade products are really the best ones, and there are a few that you can just get yourself over the counter or online, such as some of the vitamin C products, which might be really, really helpful and that don't cost a fortune. And actually, there's no difference between those and some of the more expensive brands. So, you know, we can always give you advice and a treatment regime and treatment plan if you want to pop us an email and organise a consultation.
Okay, brilliant.
Welcome back to Naomi, and we're doing another Skin Bite topic with hormonal health concerns. So we'll talk to you in this session about a few of the things that you've highlighted on the Instagram post recently. So yeah, retinols are really useful in helping to improve signs of aging, helping to reduce the appearance of lines and wrinkles in the tissues, and help promote the production of collagen. So it's nice to use in combination with other products to help to maximize your overall appearance of your skin.
Okay, so one of the questions that we had was about skin vitamin tablets. I assume they're pretty expensive. So somebody has said, are they actually worth the investment?
With the vitamin tablet, everybody has a different degree of absorption rates, and it can depend on your digestive health. It can depend on all sorts of factors. It's thought that some of them only have a 30 to 40% absorption. So if you're not getting the full benefit of the absorption, you're not going to get the full benefit of the medication. And so some of what you've spent is obviously going to be wasted and eliminated from your body without actually having any uptake at all. The drinks which are available have a suggested higher bioavailability. So it means that potentially you might get double in your system compared to the tablet.
Okay, interesting. I didn't.
Personally, for me, I would rather take the drink, because otherwise you can be taking 20 or 30 tablets to get what you need in one drink.
Okay, so the drink contains a multiple kind of supplements.
Yeah, you've got the whole combination there in a form that your body can absorb.
And I know that we're trying not to kind of advertise or promote particular brands or anything, but what would you ask for if you went somewhere to try and buy something like that?
Most of the time you can't just go and buy them. You can't just buy them over the counter. You have to have a consultation because there's specialist organisations and specialist clinics will have those available for you to be able to purchase, because these are treatments which may or may not be suitable for people. So you have to have you have to make sure that you think you're doing the right thing and that you're providing the right care for somebody. So a level of training with respect to what you're essentially prescribing for somebody is what's required. So I would personally, I have a drink every day. I make my mum have a drink every day, and for her, one of the reasons why I gave it to her was because she had some joint issues, which I wanted to see if it would help. And I think from an inflammatory perspective, and I certainly think that there's been some improvements. But these are all things that can help potentially with inflammatory skin conditions like eczema, which can often be seen in menopause as well. We often see some of those skin changes because the skin becomes a lot drier and more prone to inflammation. And you can get sort of eczema type changes, which can sometimes be dampened down a little bit by these.
So another question that's come through is there anything that we can do to improve skin laxity?
So the skin laxity really relates to, first of all, the structural components in the skin, so the collagen, the skin support structure, the bony structure that we talked about earlier. You can't really do much to help with that. Maybe your side of things, the treatment with estrogens can help to slow the bony changes, but you can maybe give a little bit more insight on that. Hydrating the skin, using the right skin care products to help to produce and promote collagen formation will help with.
How would women access those? Is that from specialists, or is there anything that they could do at home? Or
there's not really a huge amount they can do at home other than try the skincare products. The omega-3 and 6 is going to help to improve the skin integrity, and those are things that you can do at home. But I think if you're going to do an approach to help with your skin, it's better to do a combined approach that will mean that you can that you can get the full benefit and the full complement of all the individual things that are going to help to support you. And it doesn't need to necessarily be continuous. You can take these things and have a little break. So these are all things that you can sort of just have a block of treatment and then, you know, have a little rest from it if you feel that's what you need to do. But the skincare is a daily situation, and the best thing to help to reduce the issues with skin laxity and aging is sun protection, and I can't stress that enough. And that you can do at home.
Some of my patients ask me about dark circles, so as well as kind of loose, as well as kind of fine lines and things. It's the dark circles in particular. Is there anything that they should be doing to prevent them, or how they can treat them?
They can be caused by a number of things. People often come in for treatments and say, "Oh, I've got dark circles. I need fillers," and actually sometimes the issue isn't a dark circle because of a deficit of a depression that you sometimes see in the under eye as part of the aging process. As you age, as I mentioned before, the bony changes around the orbit, the bones around the eye, causes an increase in that size, and the eyes can sink. You can also lose tissue here and get depressions in the area here called the tear trough. But sometimes changes in the fat structure around the face here, because the fat cells deteriorate with age, they can cause a bit of a sinking, and then the bone structure that you see on the under eye can become a little bit more prominent and can look flat. And because it's a depression, it can look as though there's a shadow there. But people can also get pigment changes within the skin around the under eye, which is very, very common, particularly in people with already pigmented skin. But you can also, it's one of the thinnest areas of skin in your body. And as the skin ages, it becomes much thinner. And so sometimes you see the vessels underneath as darkness. So yeah, there's loads of different reasons why you might get it. So there are some things that can be done to help to lighten those areas. There are lots of serums. Sleep can sometimes also, or sleep deprivation rather, can sometimes cause an issue with darkening and circles. I'm sure you have probably woken up and looked at, well, you're amazing looking, so maybe you don't ever wake up and look in the mirror and think, oh my goodness, what have I done? I've not had enough sleep. But so the point is to make sure you have the correct diagnosis, that you've assessed the patient properly, that you have excluded any other causes of the issue, made sure that you're comfortable medically.
That patients should ask for? Anything in particular, any blood tests that patients should ask for if they have particularly noticeable dark circles that didn't go if they tried sleep and diet? And
I think I wouldn't necessarily ask for a specific blood test. I would probably do what we call a full blood count and thyroid function tests, and also just a blanket sort of basic blood screen to make sure that that everything looks okay. And as long as everything looks fine, then there's no reason to suspect that there's anything else going on. And often you can tell when you're looking at the patient that, okay, this doesn't look like there's any underlying cause. This looks like this is just pigment. It's really important to remember that do not forget these areas under the under eye with your sun protection, because sun will worsen any increased pigment within the skin. So if you have an area that is hyperpigmented, having sun exposure will exacerbate that issue. So sun protection needs to go right under there. And even when you're indoors, you might think that you don't need any sun protection, but it is a daily requirement and has a cumulative positive result if you continue to use it. So I will wake up in the morning, go and have a shower, do my face regime, and put my sun protection on, even though we've been in lockdown and even though I'm not going outside much, because you can still get radiation in through windows. As you can see, the room that I'm always working in is quite light, so huge windows, lots of radiation coming through. Your devices can cause radiation. So this is really important to make sure that all of these areas are covered, because they will change with sun exposure.
Some women might think, well, I haven't done, I'm 50, I haven't done this. Am I too late? Is it still worth doing?
I think it's still worth doing. I mean, you might be 50, but you might still have another 50 years or more. So I genuinely think that anybody can benefit from improvement in the skincare. I'm working on my mom. She's in her late 70s. So, it's never too late, and she's not bothered about anything with any of this stuff. She thinks it's all nonsense. So, but I'm getting her into it. I think it's important to manage it. At the end of the day, the skin is a living structure. It will continue to regenerate. Yes, you will have a decline because the basic aging process is still there, but it can just mean that you support it and you stop it from doing this and you allow it to do this, which is really the aim of any kind of management, really. You're never going to stop the aging process, but you can fool everybody into thinking that that you've managed it well.
And so a couple of people have asked this question, which I think is a nice one. How, when you're young, you have a kind of dewy glow, and especially when you're pregnant, it's really. How can you, and then they suddenly notice that disappears kind of around perimenopause. Is there anything that you can do to get that kind of youthful glow back, or prevent it from going even more?
Well, don't forget that some of the glow is down to the hydration levels within the tissues, which are because of hyaluronic acid that's present, and that declines over time. The collagen within the tissues.
How do we get more of that?
There are a number of products which will help boost the skin. And of course, with any good skincare regime, you can help to sort of regenerate that glowy appearance. I really started, I've never been great at looking after my skin. I've been very, very, very lucky, and I haven't had a huge issue with it, which is why I've never really bothered, and that's not an excuse, but I was just quite lazy. And it wasn't until probably about 5 years ago that I suddenly started noticing that there were changes to my skin, and I started being a little bit more religious with trying different treatments. My skin had become really rashy, quite bumpy, quite dull. It didn't look hydrated or dewy at all. And I started a treatment regime being religious with it about 1.5 years ago. And I have noticed significant changes, and it's definitely, when I wake up in the morning, it has a glow compared to looking quite dull before. And part of that is the skincare regime. I'm actually looking after myself a little bit better, but exfoliating creams that you can use, which can be great, cleansers, which can help to just shed the dead skin layers off the top of the skin. And once you actually get rid of those layers and you're producing healthy cells coming from underneath, then that's when you can start to see the improvements in the tissues. If you've got the right regime and you're doing the right things globally, you should start to see improvements regardless of what your starting point is.
Yeah, adult acne.
Acne is a real issue with a lot of women, and it can cause horrendous physical and psychological harm, because often people in their sort of advancing years, whatever that is, you know, you expect that, oh, I've got away without having acne problems. I've never had it as a teenager. I've been really lucky, and all of a sudden I'm now getting spots. And you probably remember, maybe as part of your cyclical changes, maybe having more of a spotty time during the month, every month, you know, a certain time that's maybe associated with a hormonal change. And as we age, there are the hormonal changes which can occur, and you can develop adult acne as a consequence of hormonal changes. You can also develop it as a consequence of other medical conditions, but also as a consequence of medication. Now, the chances are, as you advance through your years, your likelihood of one of those things happening is fairly high. And it's not just about facial acne. People can get horrendous acne over their shoulders, over their backs, over the top of the bottom, over their legs. It can be really quite debilitating, and people can have a huge lack in confidence as a consequence, because it can be quite severe. There are loads of ways of trying to manage it, but it depends on the severity. Of course, with anything, if it's mild, it may be able to be managed through sort of skin cleansers and over-the-counter treatments. If it's moderate, you might want to look at, is there a bacterial cause which is making things worse? Do I need to treat with an antibiotic? This is probably helpful. Sorry?
That's via your doctor.
Yeah, via doctor, absolutely. So ordinarily, I would suggest that go and see a healthcare professional and work out whether acne is actually the diagnosis. I mean, there are lots of causes of acne, including bacterial infection, blocked follicles, blocked sweat glands, and also hormonal changes, and as I say, medication. So depending on the cause of those, either withdrawal of a medication if that's safe, or if you've recently started a medication and you suddenly within a few months start developing acne, then it may be related to the medication that you've just started. So really important to just go back to your doctor and try and get some advice about whether that might be an issue, and whether perhaps you could change to an alternative, or whether indeed they need to introduce something else to help treat your acne. And that might be, yes, an antibiotic or a topical treatment. Sometimes you can get really effective topical treatments that keep it under control. And there are other products which you can use.
I'm going to try something at home over the counter. What would you ask your pharmacist for if you were just going to try and treat your mild acne over the counter?
I wouldn't necessarily advise to treat it over the counter. If you're going to use anything, it would just be keeping the skin cleansed. Try to reduce the oil in the skin, so sort of oil control pads that you can use to kind of help to reduce the oil in the skin, to help to dry it out. Really, the aim of treatment of acne is to help to dry out the issue and to reduce the infection. So, don't apply oily products to your already oily skin, and try to sort of just keep the skin cleansed. Make sure it's, you're removing makeup at night. And I know it's very, very difficult. It's easy to say, but covering your face that is acne prone with makeup is never going to help to improve it. The skin needs time to just breathe. If the pores are already blocked, adding then another layer of blockage on top is not ideal. But I can fully appreciate the psychological impacts of not controlling that by using makeup. It must be really difficult, but where possible.
Is there acne-friendly makeup that people could use?
Not really. The only other thing that I might suggest is that you make sure that your brushes are extremely clean, and that you're washing your brushes in between uses, because there's a lot of people that don't clean their makeup brushes, and it's really important that it's really important that you do.
Brushes.
Okay, that's really, really important. So you're very lucky.
What do you do?
You can clean them. You can get brush cleaners, or just, if you're not going to clean them, just have a variety of them that you will use and rotate. but yeah, no, the best thing to do is to get them clean, and then that will, because they can harbour infection. It's a bit like using a washcloth on your face and never cleaning it again. You wouldn't do that, but you do. This is the problem. You do with your makeup brushes.
Good point. Cool.
There were a number of questions about women who have gone through the menopause or perimenopausal and they've suddenly developed itching, which can be a real problem, and they've complained of redness and itching on the skin. Can you give us any sort of insight as to how, what might be causing that, or how they can manage it?
Yeah, I've seen that. I think itch is not thought of as being a symptom of the perimenopause or menopause, but of course it is. And patients have been off to dermatologists who actually, you can't see anything on the skin except for perhaps some excoriations where they've been scratching, particularly at night. So firstly, it is a skin manifestation of estrogen deficiency.
Okay.
And if patients were able to or amenable to, then HRT often can just eliminate it completely.
Well, that's actually a golden nugget, because there are a lot of people that I've seen that have said, I've got this insatiable itch, I just can't get rid of it, and I haven't even thought to ask them about whether they've been on HRT. So how quickly would it go if they've started on something?
It really depends. It's like any of these menopause symptoms. Some go quickly in some patients, some take longer, but it can disappear pretty quickly.
Okay.
The other thing to look for is, with aging and the menopause, skin gets drier, and have they got have they got an itch because they're very dry?
Right.
And so just very simple moisturising can help. Now, if they can't take HRT or it persists despite HRT, then some women take an antihistamine as well, and that can just be what they need to just eliminate it completely. So a loratadine or fexofenadine, in addition to or instead of HRT, can...
I think fexofenadine is prescribable only, so that's something that they might have to speak to their doctor about.
Loratadine,
Claritin, they can get over the counter. Perfect.
Try that first. Now, an itch without an unknown cause, especially with night sweats, you have to be a bit careful about. So I would definitely, don't just take matters into your own hand, but I would definitely discuss it with your GP. But it's definitely a well-recognised symptom of the menopause. Okay.
It's really actually important that you've mentioned about night sweats, because that is one of the main things that people think about when they're thinking about menopausal symptoms. And of course, that's probably one of the factors that leads to increased drying, a bit more dehydration, and it brings back the importance of making sure that you remain hydrated and have a good balanced diet to help with all of these things, really. And the difficulty is that you've entered this cycle of night sweats and the hormonal changes and lack of sleep, and then the stress responses as a consequence of that, and then the impacts of that on tissues, under eye dark circles. So it's really hard. And you had some really useful tips on your page about how to manage with night sweats, and I was being a little bit of a stalker and had a look at your site to give some nuggets to some of my patients. So yeah, you get a few things. Do you want to just talk about those briefly?
I remember through my brain fog. So yeah, one really useful tip is if you know that you are one of those people that does wake up in the middle of the night and you're soaking wet, then just rather than, if you have to get up, go and get changed, change all the sheets, you're going to completely wake yourself up and find it much harder to go back to that sleep. If you just keep a dry pair next to the bed so that you can just whip them off and put them on, and maybe a spare pillow so you can chuck your pillow on the floor and put a nice dry pillow there, then you firstly, you don't lie there for half an hour thinking, shall I get up, shall I not get up, shall I get up, shall I not get up? So you eliminate that, and you don't have that wake up pressure by going and fumbling for something fresh. So I think that's really, really useful. Simple thing that somebody can do at home. Sheets make a difference. If you've got a natural fibres, it wicks sweat away. It's cooler when you're hot, and it's warmer when you're cool. And then just having something cold by the bed. If you fill up, so if you've got a normal, a hot drinks thermos, it keeps hot, but it also keeps cool things cool. So if you go to bed with some water which has got some ice cubes in, then you've got a nice cooling drink that cools you from the inside. In the same way, if you're out, in a hot day and you have a nice cold drink, it does exactly the same thing. If you have a few gulps, it cools you down from the inside out.
And it helps to reduce the sweating concern and the flushing.
Yeah, and you replace the fluids that you've lost. A fan near the bed can just help cool you down, a spritzer of cold water, and then there's avoiding triggers, especially just before you in the evening or before you go to bed. So alcohol is probably the number one culprit. And women seek alcohol, whether it's consciously or subconsciously, during the perimenopause and the menopause, because if you're anxious, it can have that kind of
calming effect.
Even though the repercussions are detrimental, but it can cause night sweats in itself, or worsen night sweats. So if you can avoid alcohol, although it's not what people want to hear in the long run,
you're not going to be popular with a lot of people.
Switch off. Get rid of it really can help. Same with spicy food, with smoking, caffeine. So caffeine before bed is a no-no, because that can trigger night sweats. But some triggers affect some women and others. And if you can keep a symptom diary perhaps and just see what it is that are your triggers, then you can tailor your lifestyle accordingly. Yeah,
that's really useful information. Thank you. I think all of those points, you can easily adopt without any issues, and none of it's going to cost you anything. So yeah, really, really useful information. Thank you. But I think the importance of trying to just get the restful sleep will help overall, because with the menopausal symptoms and the anxiety symptoms that are related to it, if you can just get some rest, those are much more diminished. So if you can target that sleep section, I think people will probably find that all of their symptoms are a little bit more improved.
Yeah, it tends to either spiral kind of positively or negatively.
Yes.
The things that cause the sleep impact, the kind of the disrupted sleep, then make them worse, and it kind of spirals that way.
Yeah.
And equally, if you find ways of getting restful sleep, that then has a positive impact on those symptoms.
Yeah, absolutely. Really useful stuff. Thank you very much. Okay, so when we put out our questions, ask Dr. Naomi anything you like about hormones. Sorry, I did make it quite wide. I know your specialism is menopause, but it's all hormones, and I think we can still help people. So one of the questions which came was from one of my patients. I'm 28, I've had tests showing low estrogen levels, and I have 1 to 2 days period and some other symptoms. What can you advise her with respect to that?
If she's 28 and she's alluding to the fact she's had some kind of menopause type symptoms,
Yeah.
she needs to see a doctor who specialises in early menopause and primary ovarian insufficiency. She needs specialist help.
So definitely don't go straight to a GP, or go to a GP and get referred, or contact you.
Absolutely, she needs to go to her GP, and this needs to be taken seriously because she needs treatment. And she will be investigating as to why this has happened. Sometimes it just happens spontaneously, but in other cases there are other causes. So she mustn't just sit on that.
Okay.
To protect her bones and heart, and I mean, it'll be a big or a long consultation, detailed consultation.
So this is the kind of premature menopause we were talking about before, that we think it might be, perhaps.
It sounds like it's had tests. It sounds like she's on that track anyway, but but this isn't something that she should be, using natural supplements and nothing else for. It needs some medical intervention.
Thank you. And the other thing that I'd like to know with respect to that situation is, if the GP were to prescribe something, do you think that that's enough, or do you think they should definitely push for more specialist?
At 28, I would. Unless she happens to find a GP who has a specialist interest.
Okay.
I think most GPs would
refer. Okay. Thank you. So the issue that same lady has had is that she said, what can she do, because the doctors have told her that she's too young for replacement hormones. So I think really the answer to that is exactly what you already said, is that she needs to seek help from somebody who is specialising in things.
It's difficult to know whether she means that the GP has told her that she's too young to have the menopause, which is utterly not true. There isn't too young, and the younger you are, the more you need specialist intervention.
Okay.
Or even if they are acknowledging that she has a kind of perimenopause, then if that's the case, then you're not too young, you need them. So either way, that's incorrect.
Yes. Okay. So I will make sure that is passed on to her directly, in case she doesn't pick up on this session. So thank you for that. So one of my ladies has asked, she has some acne issues. Are there any natural ways to balance the hormones?
So in terms of natural ways, yes, there are, and those are lifestyle changes that we've touched upon earlier, or lifestyle improvements. So your skin is going to show it if your sleep is poor, if it's disrupted, especially in shift workers, that can have a really negative impact on skin. Hydration, cleansing, making sure that you eat a well-balanced diet, and eliminating processed foods and sugar. Those would be the kind of natural ways of improving skin.
And I suppose some of the other ways about, basically lifestyle factors to reduce stress, which is known to be a contributor to acne, and potentially looking at some of the more natural products that you can take orally to help balance the hormone levels and help to maintain the skin structure that way, and help to reduce those things. Antibiotics, if they're required, of course, that's not totally natural, but some people just need a short course, and they can manage with that. There was also a question after miscarriages, are there any natural remedies that can help to rebalance the female hormones? Because of course the body might be a little bit confused with respect to the hormonal changes with pregnancy, and then with a sudden drop in the loss. So how can that be helped?
I mean, hormones can be all over the place, especially after a miscarriage. So kind of sudden change in a hormone profile. It really just takes a bit of time, and it can take months for the equilibrium to reestablish itself. And it's just being kind to yourself, really, and to accept that there are going to be, you know, changes and highs and lows and fluctuations, and just accepting that it can just take a little bit of time. And it just goes back to what we were saying earlier about looking after yourself, and sleep and diet, and trying to eliminate other stresses that you may have some control over.
Perfect, thank you. That's very useful.